Good morning, everyone. I am Jessie Whittish with Kentucky Youth Advocates. Thanks for joining. Again, thanks to folks who are here for the first time, or if you're here for like the 19th time. It's always good to see all of you on Wednesday mornings. Just a reminder that we are recording today's forum to share later. We will not be recording the remarks from our representative from Leader McConnell's office, but the other remarks will be recorded. And because of that, we're asking that you stay muted. We're taking comments and questions via the chat feature. Due to time, we have a pretty packed agenda, and because we are not recording Dominic, he won't be able to take questions, but panelists can answer questions in the chat, and we will also be following up with y'all and then with Dominic from Leader McConnell's office. So if you have questions or comments, we'll try and incorporate that in follow-up communication or in a future forum, or the panelists can address those as they talk. So with that, I am going to kick it over to Terry to get us going this morning.
Hey, good morning. Thanks, Jessie. Thanks to everybody for attending. Just as Jessie said, we love seeing the every Wednesday morning people, and we also really love folks who are joining us for the first time. As you know, we have been coming together every Wednesday on the premise that never have Kentucky's kids needed partners to be watchdogs more than during these times. And we certainly have talked about that on a local basis, on a state basis, and you can't even begin to think about supporting kids during these times without thinking about a federal perspective. Now, all of you may be far more attuned than I am, but when I think about the federal effort, I get really confused. I want to give voice, but I'm not even sure how to give voice because it seems the platform and the issues are so broad, so complex, frankly, so balkanized that I'm not sure who to talk to and how to talk and what to make it my pitch. So our intent is to try to build your capacity and your commitment to reach out to your senator and your representative in the next couple of weeks. We believe that there's going to be a lot of action happening. Again, as a backdrop, and I'm sure you know this, the U.S. Senate and the U.S. House have both demonstrated really good response during this time. The next chapter is unfolding. There is a lot of common ground between those two chambers that apparently nobody wants to talk about. There are also some issues that are distinct differences. And so what we want to do today and next week is to make sure all of us are informed as to what's on the table in the U.S. Senate and what's on the table in the U.S. House. The other thing is that we have commitments from Leader McConnell, and also next week we would anticipate Representative Yarmouth's folks being on the call. The other thing that is we really appreciate is their willingness to listen to Kentuckians. So after you hear our guest from Washington this morning, we have some key partners, and our challenge to them is to Kentuckyize. Y'all like that verb? We want them to Kentuckyize the issues. So here's where this is nationally, but for our senators and for our congressmen, here's what we need for the Commonwealth. So that's the agenda today, and that's going to be the agenda next week. Again, after our opening, we're going to have some Kentucky partners weigh in. I'm really pleased to have Dominic Travis. I had thought his title was legislative guru, but he said before the call began, it was actually legislative correspondent. He works with Leader McConnell. And what I will tell you is, and some of you have been on calls, I think especially on a child care issue, what we have found with Dominic is he not only is informed and obviously can give us Leader McConnell's perspective, but he is so responsive. And the one thing that Jesse intimated is we intend to follow up with both this week's guest and next week's to make sure that we're in communication and correspondence with them on what they need to be doing to support Kentuckians. So Dominic, I know yours is a busy schedule, busier these days than most perhaps. The fact that you're willing both to share your perspective, but especially to listen, means a whole lot to us. And I think it is emblematic of the response that we've gotten from Leader McConnell around kids and COVID for the last several months. So welcome. And we'll give you the floor, after which I think Ben is going to transition to panelists. So Dominic, thanks so much for making time to be here today. And the floor is yours.
Well, thank you, Dominic. We appreciate your time very much today in providing that brief overview. We also have on the call some leaders, some advocates for Kentucky children and families who, as Dr. Brooks put in his introduction, will Kentuckyize what the HILS Act may mean to Kentuckians, and also share what additional federal action and relief is needed in order to overcome the COVID-19 crisis and to make whole Kentucky's children and families. On the call today, you will hear from Commissioner Lisa Lee of the Kentucky Department of Medicaid, Mandy Simpson, the Director of Public Policy for Metro United Way, Executive Director Adrienne Bush of the Homeless and Housing Coalition of Kentucky, Commissioner LaShana Harris of the Kentucky Department of Juvenile Justice, and Dr. Jim Flynn, President of the Kentucky Association of School Superintendents. We have assembled a truly diverse panel here to share the needs of all Kentuckians with you here today. We know that this crisis has really exposed the inequities and inequalities that our nation has faced for a very, very long time. And that affects people whether you're in an urban or a rural district. When we think about issues such as access to education in this era of online instruction through internet access, it also has exposed many of the racial inequities that we as a society have faced for far too long. And so with that, I will throw it to our first speaker, and that is Commissioner Lee of the Kentucky Department of Medicaid. Commissioner Lee.
Good morning. Thank you. I'd like to thank KY Youth Advocates for putting on this forum and allowing us to have these very important conversations about the future of Kentucky. The pandemic has definitely changed the way we operate and the things that we do, but I think it also provides some opportunity for us to take a hard look at some of the issues that have been evolving since this pandemic began and address those and build a better Kentucky. So Kentucky Medicaid's enrolled over 200,000 individuals since March 2nd of 2020, and that's all due to the COVID-19 pandemic. And we continue to enroll on average about 10,000 individuals a week. So we're enrolling these individuals at a time when many of our providers are closing their doors in attempts to slow the spread of the virus, or they're not seeing as many patients per day, which is again delaying care. And so some of our providers have moved to telehealth as a means to continue to deliver services, but not every service can be delivered via telehealth. And because of this, we're seeing a decrease in immunizations. Shots can't be delivered via telehealth. And the last thing that we want is the measles outbreak during this pandemic. So we're having to find innovative ways in order to get those children immunized. And we're very thankful for the measures that our partners at the federal level have taken to assist us during this pandemic, the flexibilities that they've offered us through the 1135 waiver and our Appendix K have been instrumental in promoting enrollment to Medicaid and access to care. And we're particularly thankful for the 6.2% increase in FMAP because it's definitely going to help alleviate some of the budgetary strains that we feel due to the increased enrollment. So as we move forward, I think we just need to keep in mind that even after this pandemic ends, the effects are going to be felt for years to come. We don't know how much it might cost to treat those individuals who were diagnosed but have lingering side effects. We don't know how many of the individuals enrolling in Medicaid will eventually leave the program, how many may stay. We don't know what our provider community is going to look like. How many providers are going to close their doors or stop seeing patients because of the increased costs associated with personal protective equipment? And the new policies that come out to address the pandemic impacts their office, creates administrative burden. One thing we do know is that this pandemic has taken a toll on our behavioral health, and especially in our children. And those effects are going to be felt for many years. They'll be manifested in different ways. It's going to impact their education. It's going to impact so many aspects of their lives. And we're going to have to deal with that for years to come. And Medicaid is definitely, it's a true federal-state partnership. And so our ask is that as we devise plans to assist states in handling this pandemic, we think well into the future and continue to involve state Medicaid partners in those plans, because the only way that we can come out of this stronger is by working together. And with that, I will turn it over to Mandy.
Good morning. Can everyone hear me? Okay. Great to be with you all this morning. And Dominic, great to be with you again. My sincere thanks for you continuing to speak with us and keep us informed throughout this crisis. I'm going to be covering a couple of issues related directly to family economic stability, and I will start with a key issue that we continue to lift up because it is critical to our children, our families, our workforce, and our economy, and you've already spoken to it today, and that is childcare. We are deeply grateful for Leader McConnell anchoring the HEALS Act in support for children and for the $15 billion specifically allocated to support childcare. We know families depend on K-12 schools and childcare for the education and supervision of their children. In fact, in our recent statewide survey of parent perspectives on childcare just from July, more than 70% reported having school-aged children. So we know for children, the learning does not begin in kindergarten. And for parents, the workday does not end with the school bell. They rely both on K-12 schools and childcare to support their children and their career paths. We also know that you have stayed in the weeds of childcare realities with us and have a lot of context. So today I'm going to jump straight to conditions of the current moment. Right now, we know that 1 in 5 of Kentucky's about 1,700 licensed providers have not been able to reopen since the spring's mandated shutdown. We also know that unfortunately, every day we are watching our partners in the sector that are operating shutter again, and more temporary closures becoming permanent. A survey conducted just last week of 100 providers in Jefferson County found that 52%, so more than half of them, did not know if they can reopen ever again if required to close for any reason for any period of time. They are on the precipice of permanent closure, even as they're operating today. This is particularly concerning, noting that we did have 110 child care centers that had at least one known case of the coronavirus in a child or in a staff member, which of course requires temporary closure. Even if centers are able to avoid positive cases, as you mentioned, they have steeply increased operating cost and significantly lower enrollments, which means they're operating with losses as high as we've heard $14,000 a week. They will not survive those deficits. Very few small businesses would. Still, even in the face of that barrier, our recent survey of more than 1,500 childcare providers, which was nearly comprehensive statewide, found that the number one concern for providers by far in considering their current and future sustainability was the health and safety of their children and staff. So we know fewer protective measures or an easing of regulations are not the answer for providers. We also know it's not the answer for parents. This month, a statewide survey of parents, the one I mentioned earlier, found that 45%, so nearly half, are either unsure, will not, or are delaying sending their children back to care, citing their largest concern as the health and safety of their children and their family members. This, of course, contributes heavily to low enrollments. So to ensure childcare, which we know is the workforce behind the workforce, exists to facilitate community and economic recovery, we have two primary recommendations for the HEALS Act childcare investments. And I know I've said this to you before, and I am going to say it again, $50 billion is the true cost of child care's survival. We are deeply grateful for every penny of the $15 billion allocated in the HEALS Act. We are also compelled to note that anything less than $50 billion will result in short and long-term situations where children do not have care, parents do not have options, and businesses do not have employees. We know that nationally, at least $9.6 billion each month is needed during the pandemic to sustain the viability of providers. So $50 billion is, unfortunately, the cost of saving the Commonwealth and the nation from a child care collapse. So we are going to continue to fight, again, for every penny of the amount we truly need for that workforce behind the workforce. Secondly, we know that it will be critical for support funds to remain nimble during state administration. A 9-month time limit on financial assistance paired with the requirement for centers to remain open for 1 year, we fear underestimates the timeline for true virus protection, something like a vaccine, and may not recognize the multitude of reasons that a center may be forced to close. Providers, we know, are already forecasting that it will take 12 to 18 to 24 months to ramp back up to full capacity and staffing. So 9 months may not actually be a long enough period to ensure their future. We think that to effectively prevent significant damages to the childcare sector and the families it supports in what we know will be an unpredictable future, the funding must be nimble and deployable throughout the full course of the pandemic and its aftermath. For childcare providers, the risks to safety and the risks to sustainability are real, and the decisions between them are impossible. Responsive investment is the solution that does not force a dangerous gamble and a decision between those two. We know parents are seeing that. As we found in our survey, 92% said they support more government funding to help providers during the pandemic. We, of course, join them and thank Leader McConnell for his continued commitment to working with and hearing the voices of parents, families, and fellow champions for children. We also want to thank Leader McConnell for the tremendous support of the pandemic EBT, which has provided to families who typically participate in school nutrition programs. School meals are a support that families depend upon and children need for every dimension of their health. So this innovative solution for our children to ensure that they do not go hungry in a world without those 2 to 3 school meals a day is inspiring and has given us all hope, even in trying times. Our state administration has recommended, as you may have seen, that schools do delay in-person classes until late September. And again, then in the fall, we're still uncertain of what the state of the pandemic will be here in the Commonwealth. With that in mind, we know federal investment in nutrition access programs and continued innovative solution building will support our children and our families through what is to come. So specifically, we want to advocate for extension of the pandemic EBT and the nationwide waiver authority of the USDA for child nutrition programs through the end of the year as we get our feet up from under us. And like you said, hopefully children return to schools, but certainly have food on their table in the meantime. Also want to lift up the power of an authorization of budget relief for school nutrition and CACFP operators, and then of course increase to WIC funding and access to continue to keep our mothers and our children strong as they grow and continue to build their lives through the pandemic. Also want to touch on our KYA partners' support for direct family assistance vehicle, the income support checks that provided $1,200 to each qualifying adult and $500 to each qualifying child in the CARES Act. We are thrilled and again, deeply thankful to see that again in the HEALS Act. And in a moment where we're all only as safe as those members of our community who are most at risk, we do want to look closely at the supports and care accessible to our most marginalized community members because we are all relying on each other in this moment. And we do see some excellent opportunities to close gaps in this second round of direct assistance to families. Firstly, adults without a Social Security number did not receive the $1,200 income support nor the stipend for their child due to their immigration status. but making this support accessible to households regardless of their income status is critical so that all Kentucky families can support the needs of themselves and our Commonwealth's children, especially as we know that they are coming together again in our child care centers and hopefully in the fall, later in the fall, in our schools. We also know the need to make income supports payments equal to children so that they would be $1,200 for children as well, who are themselves full human beings with all of the needs that adults have and more, in order for this to be the most meaningful, impactful support that it can be to stabilize households and stimulate our economy. And I want to close with talking about the foundation of critical support provided to our families, not just in this moment, but in the next 10 years, and that is, of course, the decennial census. You know, I'm sure far better than I do, that Kentucky receives $15.8 billion based on census allocations for more than 50 federal programs that support the cornerstones of our community and the soul of our society, our schools, our child care centers, nutrition programs, housing, transportation, healthcare. And I could go on and on, 50 programs worth. And we know we're facing a tight timeline to complete the census count. That's trying for us because our state needs every minute to count every person, because we need every dollar. This group in particular, and my partners at KYA, are particularly concerned about an undercount because we know children 0 to 5 are the single most undercounted census population. And children under 10 are right behind them as the second most undercounted population. So when we miss children, especially in a moment where we're risking a significant undercount, we know that they will be showing up for a decade in doctors' offices without the resources to care for them, in classrooms without all the tools needed to teach them, at meal sites without all the food needed to nourish them, and in homes without the basic needs to shelter them. So this is near and dear to our hearts, and it is a decade of our future. Right now, we know that more than 500,000 homes in Kentucky have not yet been counted, and we have less than a month to get them there. We just started non-response follow-up, which is a door-to-door operation in our community that has always been critical to achieving a fair and accurate count, yesterday. So we have just barely over a month to respond to more than 500,000 homes. We know that, I want to share some specific Kentucky data. Again, we know that children are at a high risk of an undercount, and that's compounded when a timeline is shortened. The average response rates for neighborhoods at very high risk of undercounting young children range from 12 to 25% below the average rates for neighborhoods who are at very low risk. So the houses that we already haven't counted are the ones at the highest risk of not counting children. In 19 Kentucky counties, less than 51% of households have responded, and almost all of these counties are in eastern Kentucky, where the digital divide makes it challenging to complete the census online, which was, of course, an option for the first time this year. In those 19 counties, only 19 to 28% of respondents use the online option, compared to 56 to 70% in our larger urban areas in Jefferson and Fayette in northern Kentucky. The only way to increase response rates in these rural communities is that non-response follow-up I mentioned, that actual on-the-ground, door-to-door operation, and we need more time. So to be clear around the specific ask, we ask that in the next relief package, we implore Congress to use its authority over the decennial census to expand the statutory reporting deadlines for reapportionment and redistricting counts by 4 months each, which would, in practice, allow us another month to get the complete count here in the Commonwealth. So instead of closing that count on September 30th, we'll be able to close it on October 31st. So again, what that would look like in statute in this legislation would be extending the statutory reporting deadlines for reapportionment and redistricting counts, that ultimate reporting, by 4 months each. Now, that was a lot of information, and Metro United KYA stand together and at the ready to answer any questions or follow up with any additional information you would like. But to keep us moving today, I'm handing the program over to a true expert and community champion in every way, Adrienne Bush, Executive Director of the Homeless and Housing Coalition of Kentucky.
Okay, I think I'm unmuted at last. Mandy, that was super kind, and thank you. And as someone who was a census enumerator in the last decennial census, I just want to echo everything you just said. It's super important. It's super important to all Kentuckians, and especially Eastern Kentucky. So I wanted to take a minute to introduce myself. I'm the Executive Director at the Homeless and Housing Coalition of Kentucky. We're a statewide coalition of partners and advocates working to end homelessness and create opportunities for low-income Kentuckians to live in affordable homes. We are uniquely positioned to do this work as we play a couple of other roles. We operate the Homes for All AmeriCorps and VISTA programs, funding nonprofits and communities with national service members to address local housing needs. We also directly provide housing assistance to 120 families who have experienced chronic homelessness across the rural parts of the Commonwealth. Thank you to KYA and to Leader McConnell's staff for allowing us to talk about the housing landscape. It is really treacherous right now, more so even than in the housing crash during the Great Recession. Looking at the sheer numbers of unemployment claims and the fact that most of these occurred with low-wage service sector jobs in retail, hospitality, and childcare, our primary concerns are with people on the streets or in shelters and the rental market as a whole. Usually there are about 4,000 folks experiencing literal homelessness and about 26,000 kids experiencing housing insecurity at a given point in time. Now, since the pandemic began, 48% of renters, about 200,000 households in Kentucky, are at risk of eviction over the next 4 months. We estimate that at least 58% of these renters at risk are Black Kentuckians. According to the Center on Budget and Policy Priorities, about 230 children in Kentucky are living in a household that is either behind on rent or is not getting enough to eat, or both. Providing federal rent relief would positively impact Black children, as Black families are more likely to rent than have a mortgage, although it really would benefit all low-income children, especially in cities where the ratio of renters to mortgage holders is higher. Statewide, the homeownership rate is about 65%, but in some cities and census tracts is closer to 50-50 renter-homeowner, such as Frankfort or Hopkinsville. We're also dealing with expiring or confusing orders around evictions at the federal and state levels. The CARES Act prohibited certain federally funded properties, about 1 in 4 nationwide, from initiating eviction for non-payment of rent through July 25th. And this was very much needed, and we're thankful to Leader McConnell for including it in the CARES Act package. However, this protection has expired, and such evictions can start to be heard August 24th. The White House issued an executive order over the weekend that does nothing meaningful and may give renters a false sense of protection. It merely states that HUD and HHS should evaluate whether an eviction moratorium would be helpful to minimize the spread of the novel coronavirus. In our opinion, it would be helpful and actually imperative for Congress to enact it to protect all renters as part of the relief package negotiations. The Kentucky Supreme Court began allowing evictions to be filed on August 1st. In Franklin County, the eviction docket was full by August 10th, despite a 30-day notice being required in 3/4 of the state. There is currently a lawsuit challenging the governor's eviction moratorium. For context, know that similar suits have been filed in 7 other states and localities, and the courts have found in the policymakers' favor every time, deeming that eviction moratoria are in the state's interest and necessary for public health. Neither the state nor the federal moratoria cancel or forgive rent, which is why rental assistance is so important to keep both parties whole, and why landlords need to take advantage of these programs as they get rolled out rather than rushing to court. Unfortunately, the $36 million in CARES Act money designated for people experiencing literal homelessness in shelters or on the street, with some money able to be designated for homelessness prevention, is not yet here in 119 out of 120 counties. It is particularly short-sighted of the Supreme Court to reopen eviction hearings at such a time as this, since it is cheaper, better for public health, and generally just more humane to keep families housed rather than shelter and then rehouse them. We also know that while the CARES Act was a good start, it was never going to be enough to address the back rent of folks who were laid off and at risk of eviction. We believe that at least $965 million is necessary to keep Kentuckians housed between now and May 2021. We've been clear since April that the eviction crisis was coming, and we have continually communicated that concern to our congressional delegation. We also told them that the problem was completely preventable and the policy solutions were simple. 1, build upon the CARES Act limited eviction moratorium by expanding and extending it to all renters through March. 2, build upon the initial CARES Act funding through the Emergency Solutions Grant Program and appropriate $11.5 billion to adequately shelter and rehouse people experiencing homelessness. And 3, protect renters and their landlords from overwhelming back rent and mortgage default by appropriating $100 billion nationwide in rent relief. The HEALS Act contains none of these specific provisions, all of which have been vetted and passed by the House of Representatives since May as part of the HEROES Act and the Emergency Rental Assistance Rental Market Stabilization Act. We understand and completely support Leader McConnell's priorities of supporting schools, healthcare, and jobs. But students, healthcare workers, and people in all areas of our hard-hit economy, particularly children, need to have a place to call home. We cannot contain a virus that requires us to social distance if we do not have homes of our own. Now, to take action, if you represent an organization, we are circulating a sign-on letter, and I will drop that in the chat. And then I also wanted to highlight that there is a bill, the Emergency Family Stabilization Act, that would address the unique needs of children and youth experiencing homelessness in the Senate, and that there's a companion bill in the House filed by Representative Yarmouth. This would be special consideration given to pregnant women, pregnant and parenting youth, children under age 6, children with disabilities, families experiencing domestic violence, survivors of sexual assault or human trafficking, historically marginalized, underserved communities of color, and families and youth in rural areas. And there's a call to action that I will also drop in the chat. So, as I said before, Kentucky families and kids are in treacherous waters. It will be difficult to make gains or even maintain ground in the other policy areas we've discussed this morning without a firm foundation. The good news is that these policies are overwhelmingly popular, as 93% of Americans favor emergency rental assistance, according to a recent poll. And it wouldn't involve recreating the wheel. Kentuckians know what to do. We just need the financial support of Leader McConnell. And with that, I will turn it over to Commissioner Harris.
Good morning, everyone. Thank you, Kentucky Youth Advocates, for sponsoring this forum. I do believe that critical conversations in general are good, but especially during these unprecedented times in this pandemic. The Kentucky Department of Juvenile Justice has been committed to keeping not only our staff safe, but our youth safe in all of our detention facilities, youth development centers, group homes, and day treatment programs across the state. We operate almost 30 facilities across the state of Kentucky, and really educating and mitigating this pandemic has been a strategic plan, but we're committed to doing it. The department is continually working on securing equipment and resources, PPE, to promote healthy work environments, because we are considered essential staff. Our staff, have to man 24-hour shifts, and we do have youth that are housed in those respective facilities. We're also committed to promoting safe and healthy residential environments for the youth that we serve. Noting that one of the vital actions that we've had to implement during this whole pandemic is testing for youth as well as staff in our facilities, and making sure that the youth do not have COVID or don't test positive for COVID, as well as staff. We are committed to and focused on working through this pandemic, and like I said, making sure that the youth that we serve are safe, and making sure that our staff are safe as well. Thank you so much.
Hi, good morning, everyone. My name is Jim Flynn. I'm with the Kentucky Association of School Superintendents, and so we serve the unique needs of the 171 district CEOs that lead our school districts in Kentucky, providing them with professional learning opportunities, professional assistance, leading their advocacy efforts to develop effective education policy, and then we work to build coalitions with partners that want to advance the educational programming and quality on behalf of our students and the professionals who serve them. And I appreciate Leader McConnell's staff for being interested in our voices on this, and I appreciate KYA in providing this forum for interested advocates to come together and share what we're facing. Part of my charge was to give you a little bit of an idea of what the Kentucky landscape is in terms of educational funding needs. And first I'll mention that we are very appreciative of the CARES funding. It has helped us plan and prepare for reopening of schools this fall. And as you all know, that is a very challenging situation, a very difficult situation that our superintendents, our boards, and school and district teams are facing right now. Without the CARES funding, we would not have been as far along as we are in being as well prepared as we are to reopen. But I can tell you with certainty that all of those funds have been expended or obligated just to prepare for reopening. And the needs, will outpace the funds that we were able to receive there. The other thing that we're dealing with is uncertainty on the impact of our local budgets, particularly when looking at state and local revenues that are certainly to be impacted by the pandemic and the economic challenges that exist as a result. And finally, I will mention that not only are we grappling with how to get folks back into schools safely and ensure, all of the kind of the PPE and the other safety guidelines that are in place are implemented with fidelity, but we're also trying to ascertain and determine how to deal with the education recovery needs of our students after already now 6 months absence from in-person schooling. And we all know that, we turned on a dime last spring when this pandemic started, delivered remote learning services, delivered food services, and tried to address social, emotional, and behavioral health needs to the best of our ability. But there's certain limitations that we've faced in trying to do that remotely. And we don't know all the impacts that that's going to have on our students until we're able to get them back into school and really assess their learning needs and the learning loss that's been suffered by students as a result of this pandemic. And so superintendents are really faced with lots of uncertainty in what the future holds. And we do desperately need additional funding support from all partners at all levels, including our federal delegates in Congress. The one thing I will mention, I've already said we have really appreciated the CARES funding, but we also really appreciated the flexibility that funding provided so that we could be agile and meet the unique local context needs of our students. The one thing that we know about Kentucky is that not all counties and communities are created equally and have the same needs. And so that flexibility of funding is really important. And as someone who served as a school superintendent in Kentucky for 16 years, I know the challenges that can be faced when we put too many limitations, too many strings attached to funding that really strap you from truly doing what's best based on the students' needs in your community. So that flexibility that came with CARES, we really need that same flexibility moving forward. So to deliver on an education program that is of high quality, that's equitable and personalized to each student, we really need this funding to move forward, and we hope that Congress can find an agreement really soon to provide this. At the same time, we've got to ensure that all of our students are in a safe, healthy environment with good nutrition and support for their social, emotional, and behavioral health needs as well. And to do that, we're going to need funding and support from all levels. And so we appreciate Leader McConnell's interest in helping us in this. I know, Dominic, there were a group of us that met with you, probably a couple of months ago, and we were really pleased with the response and the depth of understanding. And so I hope you can continue to convey that as we move forward in dealing with this pandemic. The last thing I'll mention that I think is related to funding needs is also some relief on some liability issues to protect schools from unnecessary lawsuits connected to the pandemic and the disruption of services. There's already been some class action suits filed nationally that have some implications on this. And this relief, we think, will protect precious resources of time and money that can be better invested elsewhere to serve our students, especially once we get them back in school. And I know we talked about that earlier with Leader McConnell's staff, and I know there's been some efforts to move that forward, but I'd like to mention that. When we talk about accountability and assessment, one thing you'll know from educators and superintendents, we're not at all opposed to accountability. But as I shared, we haven't been able to provide in-person services now for 6 months, and we do not really know the status of the education recovery needs of our students. So priority upon return must be on assessing the educational recovery needs of students. And so we have a strong recommendation of extending the waiver for accountability for this school year so that we can focus on those unique needs of our students and then deliver the services they need to get them on the road to recovery and accelerate their learning back to on target. And so we really do think that in the short term, we need that waiver in place ASAP so that educators can focus on what they need to. Long term, we do believe that we really need to begin a conversation and to begin rethinking the role of accountability, which often conflicts with our personalized deeper learning efforts in our schools. There's problems with assessments being so narrowly focused that it doesn't value the unique talents and personal educational journeys of our students. And so long term, we think that we do need to begin that conversation as well. But in the short term, we ask for that waiver for this school year so that we can focus on what we need to in the education recovery space. One of the big things that this pandemic has shown light on is the importance of internet access, broadband access to our families. And we know that not only is this an important education issue, it's an issue that needs to be addressed to ensure equity of services. As educators, we saw where the families who had broadband access and had the devices to ensure that their children could continue to receive rich educational programming and services remotely, paled in comparison to what our disadvantaged students received. My wife is a a teacher in Warren County schools, and she provides intervention services to high needs children. And I went with her one day to visit her children to deliver learning packets because they don't have access to the internet. And it was a stark reality for me and anyone that would see, you know, not only where these children live, which you've heard about some of the, you know, those challenges already, you know, but to what they have in terms of support. And so our charge to everyone is to rethink the paradigm of broadband access and look at it in the same lens as any utility like water and electricity, but not just for education, but for health and safety, for workforce, and for equity. And so we believe that partners at every level, the federal, state, and local communities need to work together to close that last mile, as we call it, to get broadband access to every home. And let's make that a priority. And then finally, I was asked to comment on, you know, some of the policy changes that might be needed to take into account race or place. And we're in a unique space right now where the convergence of the pandemic, the funding challenges, and the social and racial justice issues are all hitting our schools at one time. In fact, just recently in a conversation with some education leaders, we were talking, if we weren't dealing with the pandemic, you know, just imagine the intense efforts and conversations that would be going on around racial and social justice. And one of the things that we've been talking about are the silver linings associated with these challenges. And so there's a lot of silver linings in education space when you think of some of the issues that we've already talked about in terms of moving personalized learning and you know, equity and access forward. But there's also a great opportunity to address issues around unconscious bias, institutional bias that are holding certain groups of our students back. And so certainly one of the things that we would like to see is more conversation about how we can look at policies that will help us break those things down so that we can deliver on a high quality, equitable education for every single student that we serve moving forward. And I think there's some real opportunities to address those. So again, I appreciate our partners at KYA putting this together. I appreciate Leader McConnell and his team for being willing to hear our concerns, and I look forward to working with you all so that we can move all these things forward in these challenging times and capitalize on those silver linings that this disruptive event can provide us in new innovative ways to address the needs of our people, including our most precious asset, our children. Thank you.
All right, well, I'm Mahek Kalra, and I'm going to close this out because we just have a final couple minutes left. Thank you again to Dominic for your access insight. We know that it's a busy time for Senator McConnell and his staff, so we appreciate you being on the call today. And also thank you to Commissioners Lee and Harris, Mandy, Adrienne, and also Dr. Flynn for Kentuckyizing the needs and solutions that we have here today. We know navigating COVID-19 has, it's a true challenge for our families, our Commonwealth, and our country. And as Kentucky moves forward, there's many solutions and recovery efforts that we could undertake. But many of those solutions require federal policy change and federal budget investments. Our partners today shared several solutions, and we're to build upon the existing recovery efforts as we move forward. These solutions mentioned today can be found at our COVID-19 Action Hub and also can be highlighted in our blog called Federal Leaders, Kentucky Kids Need You. And as always, we will send a follow-up email with the recording of today's forum, information for next week's forum, and a RSVP link, the child care surveys that were mentioned, census data, all the resources that Adrienne sent, and as well as a link to our COVID-19 page, podcast, and blog. So until next time, we'll see you.